in the Children's Hospital to surrounding hospitals?
Yeah, so one of my personal passions is in global health, and I served as a vice president for a large global health organization that was focused on imaging, which is now the largest in the world, called RADAID. And in that process, we wrote a textbook on global health imaging, and we've kind of learned a lot about pitfalls and opportunities around the world in different situations. And when this research kind of started to really catch on, what immediately occurred to myself and those of us in this community was that, this technology is terrific, and I hope that we are able to help patients here at Stanford. But if you think about it, patients at Stanford, there's always a radiologist around to help. But 2/3 of the world's population, more than 4 billion people, there's no radiologist around. And that's a staggering number of people that have the same illnesses and have the same causes of death that we do. And they desperately need medical imaging, and even more than the equipment, they need the expertise to do it correctly. And what AI could potentially present is a very low-cost way to transport the combined medical knowledge and expertise here and other centers around the US and Europe, and bring that directly to the point of care in any part of the world that you want. And so I've shared this vision with Professor Andrew Eng, who you may know from the computer science department, and our labs have kind of combined to work extremely hard on massive scale deployment of these algorithms that we're validating. So if I can get a clinically validated algorithm in the hands of every practitioner around the world who would potentially use it or need it, I would consider that a big impact and a big win. And again, not having to add the extra layer of cost onto that, which is what AI can potentially do for us. So that's where my passion is.